So my name is Ashkan Ghavami. I'm a board-certified plastic surgeon in Beverly Hills, California, and I've been in practice for approaching 2 decades. So I've been in practice for a long time and have a lot of experience in both face and body. Recently had a textbook come out that I edited with colleagues of mine internationally on rhinoplasty, and I do a lot of teaching in facial rejuvenation, fat transfer techniques, particularly of both the face, breast, and of course the buttocks. And I also do a lot of high definition 360 liposuction, lipocontouring, and body contouring with fat transfer to the buttocks in a safe way. When I was in residency, I was at a program at UT Southwestern where really all the leaders in the academia there were interested in aesthetics, both medicine as well as surgery. There was a whole center that had lasers. They were already doing some injection therapies with fat transfer, especially in the malar region, nasolabial folds. A lot of facelift techniques where the facelift techniques centered on deep tissue manipulation, subsmass, which a lot of surgeons don't feel comfortable going to, and now it's known as deep plane. But one of the innovators of this then was Fritz Barton, who was one of my mentors for facelifting. And then Rod Rohrich and I also, we did a lot of articles and scientific research papers on lift and fill kind of phenomena, which is basically you're lifting, but you're filling as well, so you don't need as much lifting. You're reestablishing the deflation that happens with aging three-dimensionally, but you're also lifting at the same time. So a lot of the anatomical studies I did there centered on the fat compartments, the ligament support of the orbiculus lower lid. So a lot of lower lid periorbital facial rejuvenation we did, in addition to the dye studies we did in the lab with Rohrich, Joel Pessa, and others, talked about fat grafting and volumization as really treating the root cause of facial aging appearance, which is deflation. I was familiar with Tulip because that's one of the cannula systems we used in my training. So when I came to practice in Beverly Hills, that's who I contacted to get cannulas for facial fat transfer. I started doing buttock fat transfer and breast fat transfer about a year or two into my practice. So it was very fresh. A lot of people were saying, what is this guy doing even making butts bigger? It doesn't make sense. So I was one of the first to really do this, and I was on the first ever ASAPS panel on gluteal shaping in 2014. So not until 2014 did the societies in America actually catch on to gluteal fat transfer. And the system I used for that, they actually have a Ghavami set of my preferred cannula diameters and lengths. Multiple length diameters, they have to be large enough so you don't ruin the fat cells and damage those delicate cell membranes of fat on the way in. And then of course technique and anatomy and preoperative evaluation is everything. So all of this just is synergistic with the design of Tulip and the type of systems they have. They don't break, they work well, and I've used them for almost 2 decades now for both face, breast, and body, and buttock. So I do a hybrid system now with buttock where I start with the Tulip system, and then I get the foundation built, and in a subgroup of patients where they're having a lot of difficulty getting expansion, especially laterally to create that hourglass silhouette, I'll resort to injecting directly through the vibrating cannula system that I'm also suctioning with. But Tulip is always a part of the game. I'm excited about regenerative medicine globally, both for face, body, skin, hair, everything. I think it's going to change. It's really the next frontier in medicine, because we're now tapping into our body's own natural way of healing itself and isolating those products and figuring out how to manipulate them to put them back into the body and treat them. Right now, a lot of the high-end, most elevated ways of treating cancer isn't just throwing chemotherapy. It's actually modulating your own immune system. Our bodies are smarter than we'll ever recognize them to be, and we'll never fully understand them. So by isolating some aspects of what they already know how to do intuitively, heal itself, we already have growth factors floating around. To be able to isolate that, extract it, and regeneratively introduce it back to the face, the body, for something as superficial as wrinkles, or for something as important as cancer. It's all regenerative medicine, and that's really the next frontier. I think regenerative medicine can definitely do a lot for a lot of disease processes. Recurrent cancers, issues. We already know with just even the anatomical skin damage that's done from radiation therapy, how fat grafting softens it. And after a year of doing repeat fat injections, you can't even tell it was radiated skin. This didn't even exist before. So we do know that it stops and treats inflammatory abnormal processes in the body and skin. So there's no reason why it shouldn't help. The only challenge is going to be isolating what we really want from it and then targeting. So the problem is going to be targeting. You can't just inject something in the bloodstream, hope that it goes where it needs to go. So right now, where I use it is more of just aesthetics. So I'm targeting it for anatomical change, lower eyelids, folds, jawline, and then skin issues, and then mixing that with modalities that are energy-based, like radiofrequency microneedling and different wavelengths of lasers, and light therapy with BBL. So basically, we have the whole game covered. The last bit of it is just getting more fine-tuned with extracting exactly what we want, what purpose we want it for, and then the targeting to go where we want it and nowhere else.